Okay, the article that I chose was The Effects of Animal-Assisted Therapy Compared to Progressive Muscle Relaxation Therapy on Stress and Anxiety. This article was found on AJOT. In this article, Brandy Hurdle and Regina Abel conducted a pilot study which compared the two different therapies on stress and anxiety among graduate students, specifically OT students during finals week. It was a randomized block design that used repeated measures with two separate experimental groups. Like I said before, they were all occupational therapy students, specifically first years, recruited by flyers, emails, or in person, and they were excluded if they had an allergy to or fear of dogs. So before the process started, they all had to sign consent forms, and they all completed a variety of assessments. These assessments included demographic forms, West Side Test Anxiety Scales, Pet Attitude Scales, which was modified, State Trait Anxiety Inventory, heart rate, and blood pressure. They were all either assigned to the animal-assisted therapy group or the progressive muscle relaxation group. And then during their first 3 days of their finals week, they either completed a 20-minute session, which was just a quiet session with the therapy dog, or 20 minutes of a session that was provided using video recording for the progressive muscle relaxation. And then on the last day of their finals week, they all filled out the same assessments that they had previously filled out before the assessment started. And then the researchers were able to compare the pre and post intervention data. The analysis showed that there was a significant decrease in heart rate in both intervention groups on all 3 days. And then it was found that there was a significant decrease in this anxiety state on days 1 and 2 of the intervention. However, there was no significant difference between either group. This shows that both animal-assisted therapy and progressive muscle relaxation both decrease the measures of anxiety. And then the advantage of animal-assisted therapy is that there's no preparation required by the students, and the students may be more likely to volunteer and participate in the animal-assisted therapy sessions.